If you've ever been confused about the different terminology used in the mental health industry, then you're in the right place. My name is Kat Nichols, and I'm a content creator here at Happyful. And I'm joined today by counsellor and previous educational psychologist Nadia Wilkinson, who's going to be shedding some light on the different terms that can be used for mental health professionals, such as psychologists, psychiatrists, counsellors, and psychotherapists. So before we get started, Nadia, I would love for you to introduce yourself and tell us a bit more about the work that you do.
Sure. Hi. So yes, I trained as an educational psychologist about 20 years ago and have worked. I still do actually do a little bit of educational psychology work alongside my counselling. I trained to be a counsellor along the sort of CP/CAB route, and finished a diploma in counselling, and have a small private practice where I work with adults online. I do some counselling with young people in schools, and I do a tiny bit of educational psychology work still as well. So somebody told me I had a portfolio career the other day, and I didn't realise, but yes. So yeah, background in educational psychology, and currently working mostly as a counsellor.
Oh, amazing. And today we're going to be talking about the different types of mental health professionals that are out there. And I thought if we could go through them one by one and you shed a little bit of light about each one, that would be great. So I wondered if we could start with psychologists, because that is obviously something you have a lot of experience and understanding in. If you could tell us a bit more about what they do and how they support people.
Sure. So this is from my understanding, and experience. So psychologists will first of all have a degree in psychology. That's the kind of base training, and then usually go on and do other specialist trainings, and will work in a specialist and specific area. So I'm an educational psychologist, work in education settings in schools, special schools, nurseries, colleges, with children and young people, doing assessments and kind of planning intervention programs. You can get kind of occupational psychologists, work in the workplace, sort of with businesses, organizations, forensic psychologists, criminal psychologists, and clinical psychologists work in clinical settings, and will typically work with kind of sort of eating disorders, mental health conditions. So they work in a clinical setting, so it will tend to be in a hospital or a clinic, and will use kind of a sort of usually a sort of set intervention program, I would say, for treating particular types of difficulties. You also get counselling psychologists who, again, will have a background in psychology, a grounding in psychology, and will sort of do kind of one-to-one counselling intervention with people. So again, like counsellors, but will have a very specific training route where other counsellors may come from very different backgrounds before they come to their counselling training. So I would say, yes, psychologists are kind of scientific practitioners, I would say. They have sort of work from an evidence base, they work to theory, and I would say intervention might tend to be a kind of set program. They will do assessments, they may do psychometric assessments. So that's something of psychologists. Does that make sense?
Absolutely. That's really interesting to know a bit more about the training and how people get into that and what it is they do. Yeah, that's fantastic. Thank you so much for sharing.
And it's often kind of years of training. They will have studied and trained for quite a long time to get into their particular field of specialism. So yes, they'll be very kind of robust practitioners, I would say.
Absolutely. Brilliant. So in the kind of similar vein, how about psychiatrists? Because this is something I struggle with, the difference between psychologists and psychiatrists. So what is it psychiatrists do, and how can they support people as well?
So to me, it's quite clear with the psychiatrist. So essentially, they have medical training. They're primarily doctors. They have medical training, and they will have gone on and specialised in the mental health field to have become psychiatrists. And in my experience, they will diagnose mental health conditions. So a counsellor, a therapist, a psychologist can diagnose maybe a few things, but a psychiatrist is the person who, if you want a kind of label for your condition, they will be the one who is able to provide that. And they can prescribe medication as well, as the key difference, from sort of a counsellor wouldn't be prescribing medication, or a psychologist wouldn't be. That would be a psychiatrist, because they have medical training. And again, they would assess, they would diagnose, they would probably suggest a treatment plan, but they themselves wouldn't be giving the therapy. You wouldn't really receive therapy from a psychiatrist. They mainly diagnose. They might suggest you go off and seek some therapy, that you come back and have reviews of your medication, but that's my experience. If people are asking for a diagnosis, then I would suggest that they might see a psychiatrist, or ask for a referral through their GP. So so diagnosing, prescribing, and kind of reviewing, but not really delivering therapy as such. That's my take on psychiatrists.
That's brilliant. And that's really helpful for people watching to know that if they are seeking a diagnosis specifically, this might be the route for them to go down.
Yes, absolutely. It's not something that even something like autistic spectrum is not something that a counsellor could diagnose. Say a clinical psychologist might be able to, but primarily it would be a psychiatrist.
Oh, brilliant. That's really helpful. So moving further into the therapeutic side of things, can you tell us a bit more about counsellors and psychotherapists? And we know that there is some debate in the mental health industry about the differences between counsellors and psychotherapists. So I'd love to hear your thoughts on it, if you believe there is a difference or anything like that, and how they support people as well.
Yeah, sure. And also the term therapists come in as well. I think my understanding is people kind of use counsellor and therapist interchangeably. I don't know whether it might be slightly more kind of an American term, therapist. I know in publications, when I read sort of American publications, they tend to talk about therapists, but I tend to call myself a counsellor because I think it's clearer what I am. I think therapists, there are, you could be a beauty therapist, a massage therapist, a speech and language therapist. There's so many different therapists, where if you say you're a counsellor, I think it sort of hones in on people's understanding a bit clearer. But I know lots of colleagues call themselves therapists. And then in terms of a psychotherapist, I do think there is a slight difference in it. It wouldn't just interchangeably say a counsellor and a psychotherapist. They have a strong grounding in what's called psychodynamic theory, and this is kind of Freud's work. So lots about how our kind of subconscious influences our behaviour, and lots of patterns of behaviour will have been formed from our childhood, from our early interactions, our early life experiences, that sort of continue into adulthood. And then sometimes these very set patterns of behaviour we've learnt in childhood don't serve us very well, and we might need to look at and change. So if you're seeing a psychotherapist, you'll be you should expect to be asked about your early life, your childhood, your relationship with your parents, which other therapists may not kind of delve into. And they'll be looking at things like kind of dreams are quite important to psychotherapy, the subconscious trying to kind of give you messages about what might be going on, and things like defense mechanisms creeping in. What defense mechanisms perhaps are you using that is kind of blocking your emotions, or what's really going on for you? So I do draw on psychotherapy. I call myself an integrative therapist. So I do draw on some of the psychodynamic and also person-centered, which is another theory, but that's more about how you interact with the client, kind of being non-judgmental, empathic. I'm trying to be very authentic in your relationship, so it doesn't feel like you're kind of a cold, distant, clinical, stony-faced person. But yes, so I do think psychotherapy, there is a particular way of interacting, particular sort of line of questioning, and sort of patterns that they would be looking for. Does that make sense?
It does, and that's really clear, actually. That's not an explanation I've heard before, which I found really helpful to know that that's the kind of grounding in the work. And I was going to say, for anyone watching, if you're interested to learn more about the different types of therapeutic approaches, we do have a section on Counselling Directory called Types of Therapy. I'll link it underneath this video so that you can go and see, because it is quite helpful to know those things and potentially have a bit more of an understanding about what approach your therapist or your counsellor might be using with you. And I think you're quite right what you said about the difference between counsellor and a therapist. I think it is a bit of an Americanism, and I know on our site we definitely see people coming to us more and more for the word therapist. which is interesting. So, and it seems more people are calling themselves that, but yeah, counsellor and therapist can essentially be a similar thing, and then you can look further into what approach they use. So yeah, that's really helpful, thank you. I was wondering whether or not, do you think clients would find it helpful to know what type of professional they're going to be looking for, or would you think they should ask for support from their doctor when it comes to picking a mental health professional to work with?
I think it can be helpful to perhaps seek some advice from your GP, perhaps for a steer of what you might need. I think particular kinds of difficulties respond well to certain kinds of intervention. If you've got a phobia, for example, of something, then a psychologist would probably be the best person to work with. They'd sort of work through quite a specific program to kind of desensitize you. Or, you know, if you've got particularly severe kind of PTSD, there are specialists. There's EMDR treatment is I can never remember exactly what it stands for. I did make a note of it somewhere. I can't find it. We might
is it eye movement desensitization?
Yeah,
or EMD, probably are.
Right, yeah, I've wrote it so I can't see it now, but that's been shown recently to have a really good evidence base for working successfully for people with post-traumatic stress disorder. So I think your doctor might give you a good initial steer if you're very unclear as to who you want to be working with. But I think yes, potential clients should read up perhaps about the different kinds of therapy on offer, just to be clear, because when you read through lots of profiles on kind of counselling directory or BACP, I think as a layperson, I know before I came into the field, I wouldn't have understood the difference between somebody who's saying they're a person-centered therapist, a psychotherapist. But I do think it is good to, when you read the profiles, you may just connect with something somebody said, you know, it just feels to you like this person's kind of on the right track, or saying things that you're going, oh, yeah, that's me, or you somehow find a connection with. But I think it is really important to perhaps, most people offer a free initial discussion, perhaps on the phone, or maybe do a first trial session, because the biggest kind of predictor of success of any kind of therapy is the relationship you have with the therapist, how comfortable you feel with that person. So I would say, you know, definitely perhaps approach a few different people, have that initial discussion and see who you feel most comfortable with, but also perhaps ask about their approach. Because interestingly, I've had a few people contact me recently and saying they have had therapy in the past or counselling in the past, and they found the counsellor quite kind of non-responsive. The counsellor wasn't really saying much, giving much back to them. And when they talked about the kind of therapy they'd gone for, I was saying, well, actually, that's the style of that kind of therapy. So I think people don't always know what it is they're looking for. And I think it's being brave and honest enough to say to the counsellor or the therapist, if you don't feel this is working, or if you're not getting what you want from it. But I think that's why it's important to have a sense of the different styles, because it may not kind of give you what you want if counsellors are working in a particular way. Yeah. So, but it is mindful. It is confusing. I definitely acknowledge that. You know,
it is. There's lots of different approaches, lots of different terminology. So it can help just to do a little bit of research, just to understand it all. And you mentioned there the importance of rapport and building up that sense of trust with the professional, whoever you're seeing. Is there anything else you would advise clients to maybe look out for when searching for a professional, aside from maybe the type of professional that they are?
I would just make sure people are kind of BACP accredited or have some kind of accreditation. There's also, I can't remember the UK CP, I think UK counselling and psychotherapy, because you don't actually have to have any particular qualification to call yourself a counsellor or psychotherapist. So I would hate for people to sort of go to people who are not being properly regulated or supervised, or, you know, making sure that you're not entering into any kind of harmful relationship potentially, and that look out for things like you know, counsellors or therapists sending through a contract for you, a way of working. It should be kind of a professional working relationship. I think going with gut instinct, if for some reason you feel a person doesn't seem professional, or, well, you know, sort of associating themselves with professional boards and bodies, then I would be a little bit wary.
Definitely, that's really helpful. And Yes, that's something we're very aware of in Counselling Directory as well. We ensure that all members that join us are a member of a professional body, just to give that extra layer of protection, knowing that they have to abide by a code of ethics. There is a
Yes.
complaints procedure if
Yes.
anything goes wrong and things like
Yeah.
that. So that's really helpful. Thank you
Yeah.
so much, Nadia. So before we go, could you please share where viewers can connect with you online if they want to get in touch?
Yeah, sure. So I'm listed on the Counselling Directory. I'm on the BACP directory as well. And I've got a website. It's nwcounselling.co.uk if you wanted to look me up directly. But yeah, lots of ways of finding me if you want to find me.
Brilliant. Thank you. And for anyone watching, if you want to learn more about different types of mental health professionals, the different types of therapy, and to find mental health professionals, just head to counselling-directory.org.uk. And thank you so much for watching.